Hello. Well, good morning, depending on what time of the day you're watching this. It's good morning or good afternoon. We have always, you know, planned or decided to provide our patients with more value that they can get out of our dental office or dental practice. And in an effort to provide more value to our patients, I have decided that every month I'll go ahead and send out this video emails uh, about teeth. Some information that can help you with to get to take care of your teeth better. So this today I'm gonna go ahead and talk to you about some silver fillings, and I'll try to keep it about 10-15 minutes, less than that. One of the most common thing that we see in our office is when the patients have toothache is with broken fillings. That's one of the biggie. As a matter of fact, today we had two patients who came in with issues of broken filling. So I want to go ahead and talk to you about this. And so the patients, now if you have silver fillings in your mouth that have been in there for years, uh, then I think it probably applies to you. Silver fillings were the way to go for years back. They have been in dentistry for more than 100 years. They were the go-to filling because obviously they were cheaper, and they were easy to place. However, because of advances in dental technology and the issues that we are having with the silver fillings, we have come up with better, different options right now. So let me talk to you about what are the issues we are noticing with the silver fillings. First of all, silver fillings, obviously they are not most aesthetic looking fillings. They are silver. Second thing, they are made up of silver fillings are made up of a combination of silver and mercury, and as we all know, mercury is considered something that can cause cancer. So that is also one of the reasons why we want to stay away from it. Now, still, as a position of a California Dental Association or American Dental Association, they still say that silver fillings are safe, but there are very independent different researches that would rather not have silver fillings done. Bottom line, if you were my family, I would not put silver filling in your mouth. The third disadvantage of the silver filling is they corrode, they stain, because obviously metal nature, they corrode. And fourth is putting silver filling in your mouth causes lot of lot of extra drilling needs to be done in a tooth which requires a silver filling. Because of this extra drilling, the tooth becomes weak, and that is one of the reasons why they crack. And I think there's one more reason. One of the disadvantages of silver filling is as they get older, there are leakage around the silver fillings. And because of this, I have often seen patients coming in with the cracked teeth. These cracked teeth, they need to be pulled out sometimes, depending on how deep, how bad the fracture is. They need to be either root canaled, sometimes they need to be crowned. So I want to talk to you today about what are the different options that we have to replace these silver fillings. There's two main different options as far as as far as replacing the silver fillings. One is composite and one is ceramic. So composite is where we remove the old metal filling, and if the old metal filling is really small, it is not too extensive, then we can use composite material. This is just as strong, and it just minus all the disadvantages of the silver. The second is ceramic. I'm going to go a little more in detail with ceramic. Ceramic is obviously tooth colored. Number two, it actually bonds to the tooth, and because of the bonding, it requires less tooth structure. It is aesthetic looking. There is no staining. There is no secondary leakage, and it is just as strong as a natural teeth and long lasting. So let me kind of show you what it looks like actually putting a silver filling in there, or how does it work. Over here I have a model that shows a tooth with a silver filling. what you see is that there's a tooth with a silver filling in it, and this part over here and this part over here is a natural tooth. Now traditionally when the tooth breaks, or we are supposed to remove the old metal filling, what we would have done is traditional way, we would have removed the old metal filling, we would have removed all the tooth structure that is healthy and then put a cap on top of it. But because of the ceramic restorations that we have nowadays, we don't have to remove all this healthy tooth structure. So what we would do is we would remove this old metal filling, and we are able to actually save this two part of your natural teeth, and we replace it by porcelain. So it just looks really nice. Let me show you some other pictures of what I actually mean by this. Alright, so here it is. This was a patient who came in. She had old metal fillings in there, and we replaced it by some partial or ceramic onlays. This is the old metal filling, and like I said, it is pretty common with this metal filling is as they get older, the junction between the metal and the tooth, there is some weak spot, and there's some cavity that started. So this patient had sensitivity around this old metal filling, and so we decided to go ahead and remove the metal filling and replace it with ceramic. This is the after picture. As you can see, it looks really beautiful, and we were able to save this natural tooth structure. We were not, because she did not have that extensive damage, we were able to save it. Let me show you this another picture right over here. So this patient over here has old metal fillings. There is decay around it. There is several crack lines. And what we were able to do for this patient is we removed all this metal filling, we removed the decay, and we were able to save this tooth. We did a full crown over here, and these two were smaller ones, so we were able to do it by composite filling, the one that I was talking to you earlier about. So these two teeth, they were done by regular composite filling or bonding, and this we were able to do by crown. The great thing about this is we are able to nowadays, I have this great machine in our office. Most of you are aware of it. It's called a CIREC. The really cool thing about CIREC is we can able to do this all in one appointment. Traditionally, the way it has been done years back is we remove the old metal filling, we do the crown prep, we send it out to the lab. It takes about 2 weeks, and then you come back after 2 weeks and we put the permanent crown on. But this CIREC machine that we have is really cool. We are able to do all of this in one appointment, and we have had great success rate with it. I tell my patients, if there's anything that happens to any of these fillings that we do for next 2 years, we'll replace it at no charge. So you have like full warranty on this stuff for 2 years. What I would welcome you to do now is, give our office a call and find out if you are a candidate to get this metal fillings replaced. Now for this next 1 month, what we are doing is if you get 2 of these old metal fillings replaced by ceramic onlays, we are doing free teeth whitening for you. This teeth whitening costs about $350, but for this 1 month only until March 31st, we are going to go ahead and do that at no charge. So get 2 of these old metal fillings replaced by onlays, and you can get your teeth whitening at no charge. Other thing I wanted to tell you is, most of you who have insurances, I don't know if you know, but the replacement of these metal fillings are covered completely. I have had some insurances that cover it at 100%, but average it is somewhere between 50 to 100%. They are covered. So yeah, give us a call to find out if this is right for you. If not, we always have some specials going on. Now, before I take your leave, I just wanted to tell you we are doing this contest in our office. We are giving away iPad Air. Refer your friend or a family, and we'll put your name in our drawing to win iPad Air. The drawing is March 31st. You just have 1 month left. We would love to take care of your, or of your loved ones. If you're happy with what you're doing, we'd love to see your friends and families. And that way, we'll go ahead and put your name to win this iPad Air. Well, thank you so much, and looking forward to see you in our office next time. Thanks.